Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast. What's up, Everything Medicare Podcast Nation? This is Christian Brindle. Hope you're having a great day, and I hope you've had a great week, folks. Every single week, I bring you 3 podcast episodes where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement, Monday, Wednesday, and Saturday. Today is Saturday, so I hope you had a fantastic week, and folks, we are just a couple of days away from October 15th. Which is officially the first day of Medicare open enrollment, also known as the annual election period, which stands for AEP for short. AEP, folks, is the time period where people on Medicare can make changes to their prospective Medicare plan. They can change from a Medicare supplement to a Medicare Advantage plan. They can change from a Medicare Advantage plan over to a Medicare supplement with a Part D drug plan. They can change from one Medicare Advantage plan to another, and during the enrollment period, folks, it's the time period where all of the insurance companies in the Medicare world announce their changes on their particular Medicare Advantage and also Part D prescription drug plans for the next upcoming year. In this case, it will be January 1st, 2020. And so I hope that you have enjoyed some of our content and some of the information we've been putting out. I have a lot of opinions about the enrollment period, and I believe that there's a right way and a wrong way to go about it as far as, touching bases with your plan, making sure that you not only have the best plan for you, but that you're with a quality broker and agent that takes care of you. I actually own a brokerage, if you've never listened to me before, called Christian Brindle Insurance Services. We work with people in the states of Utah, Florida, Idaho, Oregon, and now the state of Texas, where we work with people on Medicare health plans. We partner with all of the largest insurance companies in the industry, and we help people sort through their options to find the best available fit based on their particular needs and preferences. Listen all the way to the end if you'd like more information about how to get in touch with me and contact with my company, if you'd like a free, no-obligation consultation on what you might have. Today, folks, I am wanting to talk with you about Plan G going into 2020. And the reason I want to talk about it is because I've seen a tremendous amount of misinformation on what's going to be changing with Plan G in 2020. If you've listened to me talk before about Medigaps and Medicare supplement programs, then you know that Medicare supplement programs never change their benefits from year to year. And also, the benefits are standardized across all the companies, meaning that every single company that carries a Plan G or a Plan F or a Plan N particularly, all of the Gs across the board will be the exact same benefits from company to company. The only differences, in my opinion, are 2, and that is the price for the plan. You could literally pay double with one company opposed to another for the same exact plan, and also what the rate increases are going to be going forward. There's been a lot of misinformation with Plan G, and I'll explain what I mean by that. Starting next year is the integration of the ever-popular, ever-controversial, widely discussed and talked about MACRA bill, which was passed officially in 2015. A lot had to do with the MACRA bill, especially with Medigaps and Medicare supplement programs. The first thing that comes to mind, if you've listened to me or listened to somebody else talk about this, is with the MACRA bill is highly impacting Plan F and Plan C, although you don't see too many people out there with a Plan C. Many more folks happen to be on Plan Fs. Plan F and Plan C starting next year are being grandfathered in. And if you have a Plan F or C, you'll be able to keep it. You won't be canceled despite any misinformation out there by any person in the insurance industry that is breaking the law by using scare tactics to try to misinform you that you may lose your plan. but it's not going away. You're going to be grandfathered in. What's changing with Plan F and Plan C is if you become eligible for Medicare, after the year 2020, you will be able to still pick, well, you will not be able, to pick up a Plan F or C. So newly eligible people starting January 1st will not be able to pick up a Plan F or C. However, if you became eligible for Medicare before 2020, so let's say you turned 65 and got onto Medicare in 2019, or even if you didn't get onto Medicare, let's say you postponed your Medicare down the road, let's say you're still working, hypothetically speaking, you will still be able to pick up a Plan F or C in your particular situation as long as you were eligible. Entitled is the word for Medicare Parts A and Part B. Even if you chose not to take it, eligible means you had the option of taking it, whether you chose to take it or not. So those people will still be able to pick up a Plan F and or a Plan C starting in 2020. But there has also been some buzz about Plan G because of this macro bill. There's been a lot of people discussing Plan G on how it's going to be impacted by the macro bill. And one thing that I've heard tossed around is that the Plan G will next year become a guaranteed issue plan. For those of you who are not familiar with what the term guaranteed issue means, what guaranteed issue means is, let's start out by just talking about how a Medicare supplement works as far as eligibility is concerned. When you first turn 65 and get onto Medicare, you are able to pick up any single Medicare supplement program you like. No health questions, no underwriting. It's a straight shot. The nice thing about a Medicare supplement is once you have it, you can never lose it. As long as you pay the premium, that's the exception. However, after that window has came and gone, so let's say you're 3 years in, you're 68 years old at this point, you don't like your particular supplement. Let's say the rates are shooting up through the roof and you want to change to a different one. The new supplement company at that point can ask you health questions and put you through underwriting. And if they don't like what they see, they have the option of saying no. Very similar to life insurance or other products such as that. So, it's vitally important that you make good decisions when you turn 65, in my opinion. However, there are some criteria put into place to protect people in certain situations. So let me give you an example. Let's say somebody has a Medicare Advantage plan, and they live in Hillsborough County in Florida. I use that as an example because I lived there once upon a time. So they live in Hillsborough County in Florida. So, they live in Hillsborough County. They have Medicare Advantage plan in Hillsborough County through XYZ Insurance Company. Let's say at the end of a calendar year, this plan in Hillsborough County decides that they are cutting bait with that particular plan. They're deciding they're not going to renew it going into the new year. So, every single person at the end of the year, when this happens for Medicare Advantage plan, gets canceled. It's a nice way to say it gets canceled. They would say that they're not renewing the coverage going into next year. But they're really canceling the coverage. So, all these people will be left without coverage. Now, they could sign up for another Medicare Advantage plan if they like, or maybe if they wanted a Medicare supplement and they just decided not to take one at 65, but they changed their mind down the road, but maybe they have health problems and they weren't able to get one after the fact. Any Medicare supplement plan that participates in this term known as guaranteed issue has to accept that person with any insurance company with no health questions, no underwriting. It's a straight shot, which is great for the people that are getting onto the plan, but not so great for the people that are already on the plan. Why is this? Well, simply put, the reason is because the people on the plan have their rate increases impacted. A rate increase is typically determined by all of the people on the plan with you, not particularly based on your specific usage, but it's an average of everybody else that's on the plan with you. And the more people on the plan that are sicker, the more claims get paid out. And the insurance companies tend to make up the difference in that to keep the plan profitable for them by raising everybody's rates. And this typically causes rate increases to start going higher and higher with particular plans. The Medigap plan known as Plan F did this for forever and ever, since 92, since it came into the marketplace. And after about 20 years of taking that toll, the rate increases on Plan F, in a lot of cases, started to go sky high since about 2012 to 2013 from now. The prices began to inflate. So, these people have been saying that due to this macro bill, Plan G, starting next year, will be a guaranteed issue plan, along the same lines as Plan F. And it's partially true, but it's partially a lie. Stay with me into segment 2, and I will tell you what's really happening with Plan G that I have not heard anybody say as of yet, but they haven't looked truly into the bill. Don't go anywhere after a quick message from Randy W. Hall, the Mr. Nice Guy Medicare advisor. You're not going to want to miss this, but I'll be right back in segment 2. Don't go anywhere.
What's up, everybody? This is actually Randy W. Hall, Mr. Nice Guy Medicare advisor, not Christian Brindle, your esteemed host. I'm here to tell you about my Medicare agency, Mr. Nice Guy Medicare Advisor, based here in Tennessee. For the past 10 years, I've been helping Medicare beneficiaries just like you in Tennessee and Kentucky maximize their Medicare. If you're a regular listener of this podcast, you know Christian always encourages you to deal with a broker in your state who sells all the different plans and will give you not just a quote, but also advise you and educate you in a way that is simple to understand. We know how confusing and overwhelming the whole process can be. We do it all for folks on Medicare, from supplements to Advantage plans, Part D, cancer products, hospital indemnities, and more. So if you want to get a free quote or a consultation, I urge you to call 615-578-5174. Again, that's area code 615-578-5174. Or for more information, you can visit my website and read all about me at MrNiceGuyMedicareAdvisor.com. That's all one word, MrNiceGuyMedicareAdvisor.com. And again, why deal with a jerk when you can deal with a nice guy?
Welcome back, everybody. Thanks for sticking with us on this episode of the Everything Medicare Podcast. And thank you for that message from Randy W. Hall. If you live in the states of Tennessee or Kentucky, I encourage you to give Randy a call this open enrollment season if you feel like you need help with your Medicare plan. He's got multiple companies. He's a Medicare expert. He's got a tremendous amount of experience, and he's got integrity. He's someone that you need to be working with if you live in those particular areas. Now let's move on to this second segment of this episode of the Everything Medicare Podcast. Despite how long it's been since we started doing 3 episodes, I still can't get out of the habit of saying this week's episode, even though every week we do 3 particular episodes, like I mentioned at the beginning of this podcast, Monday, Wednesday, and Saturday, so forgive me on that. I will kick it sooner or later. But old habits die hard, and this seems like to be one of those habits. So, what is true and what is false with Plan G going into 2020? Well, if you look closely at the macro bill and all the information that's being put out by the insurance companies, Plan G will be guaranteed issue, but for people that are newly eligible to Medicare. Let me explain. Newly eligible to Medicare means that they postpone their Medicare Part B at 65. So let's say someone turns 65, they have good work insurance through their work, they decide to keep it for 5 more years until they're 70, and to which point they decide to retire and walk away from the company they work for, as well as walking away from the group plan that they have. So, what they do is quite simple. They get onto Medicare. Let's say this takes place in 2020, after this change with macro takes effect. Starting next year, that person will be able to get a Plan G with no health questions, no underwriting, a newly eligible person. in that particular situation. In the past, they could not get a Plan G. In the past, they just couldn't do it because Plan G could only be gotten with no health questions, no underwriting at age 65. That's the big change. But let's say someone's already on Medicare and they're canceled on a Medicare Advantage plan, like I mentioned in that example in segment 1. Or let's say, hypothetically speaking, they're on a work insurance plan and the work insurance plan decides we're not going to cover you anymore and they cancel everybody on the retirement plan. People in that instance, that type of guaranteed issue, will not be able to get a Plan G. That's what I've come to understand. So because of this, all the people that are telling you that this guaranteed issue process will cause the rates to go through the roof are just full of it as far as I'm concerned. Because there's such a greater danger for the existing people on the plan, however, when it comes to dealing with a guaranteed issue product when you're dealing with people that are not newly eligible, in my personal opinion. Are they going to have more sick people come into the fray because of this change? Yes, but it's not even close to what they're talking about. Plans like Plan F that participated in guaranteed issue got to the point because they were participating in all sectors of guaranteed issue for a very long time. I'll give you an example. Like, let's say there's someone named Ronnie. Ronnie has been working for a company for 30 years. He turns 65, he retires, the company gives him a retirement package, which includes retiree benefits, which he likes, so he keeps it. Let's say after 5 years. 5 years is a good example for these. So Ronnie then turns 70. The retirement program decides they're going to drop the insurance, not just for him, but for everybody that they have on their retirement package. Let's say they just can't afford it or whatever the case may be, which is their prerogative to do if they want, by the way. So Ronnie gets dropped. Ronnie has Medicare, but Medicare on its own, like I've said so many times in this podcast, is not enough. Pays 80% of coverage, leaves 20% behind for you to pay, and that's after significant deductibles had been met. You don't have coverage for anything when it comes to prescription coverage, dental, vision, hearing, etc. So, Ronnie decides he wants Medicare supplement. Ronnie still can't get a Plan G in 2020. He'd have to go through health questions and underwriting. Let's say Ronnie, instead of it being a retirement plan, will switch it up. Let's say Ronnie was still working for this company and he had coverage through the work, because the rule is it has to be through a current employer to be able to postpone your Medicare Part B without any penalties. So, Ronnie does this. Ronnie works till he's 70, then he decides to walk away. He then gets on Medicare Part B. In that case, Ronnie can get a Plan G guaranteed issue. But it's not in every instance like it was with the F. So to expect the rate increases to just go sky high like they did with the F, number one, is ridiculous because it's not even taking in even close to as many guaranteed issue cases every year starting next year as the F did for many, many years. Not to mention, it took 20 years for the Plan F to really start having the prices inflate with guaranteed issue. Like I've said before, Plan F came into the marketplace in 1992, folks. It was by far the most popular Medicare supplement plan all the way until about 2012-13. That's when the market started to shift more towards the Plan Gs and the Ns. So keep this in mind. And if you're watching this on YouTube, we're having a little technical difficulties with our camera. Next episode, we should have it up and running, so the rest of the video will be on video. But this episode, we only have partially on it just because we're having technical difficulties. So I apologize in advance. But that's what you need to know. It's not what they're saying. They're not being completely honest. It's not full-on guaranteed issue benefits that are being added for the Plan G. It's only partial. So I wouldn't expect the rates to just shoot up and go sky high because of that fact. Could they potentially be impacted? Sure. Will it happen right away? No. Will it take some time? Yes. But will it be even close to the impact on the rate increases as some people are suggesting? I don't think so. Absolutely not. We'll have to see, but I still think the Plan G, at least for the next 5 years, is by far the best Medicare supplement plan in general. Now, in some markets, if you can save 30, 40, 50 bucks a month in premium for a Plan N, is that a better price? Is that a better deal for you? Probably. In some markets, are Plan F still competitive? Yes. A lot of this depends on where you live. But it's tough to give absolute statements when we're doing a nationally broadcast podcast where people from all over the country are listening. So unless you're in a situation like that where the F is a fantastic rate, let's say it's a new block of business, or the Plan N is just an incredibly lower premium option than a Plan G would be, then I would consider those plans. Or even if it's not, let's say the Plan N is $15, $20 a month difference in premium, but you're incredibly healthy, you don't go to the doctor much. For those of you who don't know, the Plan N has $185 yearly deductible that it does not cover, which is known as the Medicare Part B deductible. This is the only out-of-pocket I'll have you on a Plan G. $185 deductible one time per year, and that's all. After that's met, you have full medical coverage. As long as Medicare pays first, the Plan G will pay everything after that, after the deductible's met. The Plan N, on the other hand, has the same deductible, but it comes with some copays. It does not. It has up to a $20 doctor copay. It could be less, but up to a $20 doctor copay, a $50 emergency room copay, and it does not cover Medicare excess charges. And depending on what area of the country you live in, that could be no concern or it could be a great concern. It just depends. But if you're incredibly healthy, but you like the stability, you like the guarantee of a Medicare supplement, then in that case, a Plan N could be a good plan for you. A lot of it just depends on your personal situation and preferences. But if I had to say as a whole, in general, what plan is the best value based on what the premiums are going to be in most places, compared with the rate increases going forward, compared also factoring in the coverage you get on top of it, I would say a Plan G will still continue to be the best plan. And I don't think the people that are saying otherwise are necessarily saying the whole story. Plan N's a very close second, in my opinion. Plan G and N, those are the two ways to go. Either way, you can't miss. Depending on your situation, maybe you could miss, but they're both very good plans going forward. But we have to be honest and tell the whole story. Plan G is still a monster. Plan G is still an incredibly competitive and great value for your money. Plan G is not some broken plan, despite what they would like you to think. Don't go anywhere. I have more to say about this in our third and final segment after a quick word from this week's sponsor. Stay with me. Don't go anywhere. You're not going to want to miss my final thoughts. Welcome back, everybody. Thanks for sticking with me to our third and final segment of this episode of the Everything Medicare Podcast, episode 108. And everybody that listens every single time we put out an episode, thank you so much for your support. Thank you for everything that you've done to help us reach more people just like you that can need additional information and perspective on Medicare and just basic understanding on what your choices are. Because if you don't understand what your choices are, how can you possibly know which one's the best choice for you? I've always said that, and I find it insanity. I find it craziness that people in our industry don't think that educating people on Medicare is important. Well, I do. I push back against the industry. Sometimes I'm in favor of the industry. Sometimes I'm not. I try to be objective on this platform and try to give you my honest opinion and perspective. But there's nothing wrong with understanding more about your choices. And that's what this podcast is designed to do. So thank you so much, folks. My closing thoughts on this whole Plan G thing is don't let people scare you out of your plan. If you have a Plan G and you're still a very competitive price, and you're with a good insurance company, everything that I've preached on this podcast over the years, nothing has changed. This macro bill doesn't change anything with that. Because the whole story is not being told about the guaranteed issue thing. Not from my understanding, not from when I went through the bill, not from all the information I've received. So keep it in mind. Keep it in mind. I hope I helped. And thank you so much for listening, folks. As I said at the beginning of the podcast, if you live in one of the states that we are licensed and appointed with multiple different insurance carriers and you'd like to talk with me, I'd love to talk with you on your particular situation with your Medicare health plan. We're licensed and operate in the states of Utah, Florida, Idaho, Oregon, and Texas now. So if you live in one of those states, please give our office a call during the enrollment period. We'd love to be able to talk with you. 801-255-5340, 801-255-5340. Our services are free, consultations free, no obligation. If nothing else, you could be on the best possible plan for you, but you can sleep better at night knowing that, not having to wonder, not having to stress, not having to worry. Thank you so much, folks, for all of your support. As always, if you're listening on a platform that allows it, please do me a favor and leave us a review on what you like about the podcast. It helps us reach more people just like you all around the country. Have a great weekend, and we'll be back with another episode on Monday. Talk soon. Take care. God bless.